Order, order. I call Peter Dowd to move the motion.
Thank you, Sir Robert. First of all, it's a pleasure to see you in the chair this afternoon. Secondly, I'd like to thank all the organisations who wrote to me providing information, statistics, views, observations, as well as asks, so to speak, in relation to this important matter on mental health and long-term conditions. And I want to set out the list of those who wrote in because it's important to pay testimony to the breadth and importance and depth of this issue to so many people, to so many of our constituents. Parkinson's UK, who requested the debate in collaboration with others. Impact on Urban Health, British Psychological Society, Cystic Fibrosis Trust, the Royal College of Psychiatrists, Marie Curie versus Arthritis, Genetic Alliance, JDRF, Type 1 Diabetes Charity, the Kidney Care UK, Kidney Research, the MS Society, Scope, Dementia UK, the Centre for Mental Health, the Royal College of Nursing, King's Fund, the LJ, and of course the excellent House of Commons research team who produced a paper for this, and thanks to them. I do hope I've caught all the organisations that have written to me, and if I haven't, my sincere apologies to them. I have to say that the information provided, which was very wide-ranging, was fascinating, it was informative, comprehensive, and of course, at times, very worrying in what they were saying. So rather than hear from me, I want members to hear from those organisations, given that I will quote pretty extensively from what they tell me, and then I do have asks of the Minister in due course. People with long-term physical health conditions are more likely than the general population to experience mental ill health, and this combination leads to poorer quality health outcomes and reduced quality of life. And the key to improving mental health outcomes, Sir Robert, in people with long-term conditions is integration between physical and mental health care to provide holistic support. And of course, as the Minister knows, the forthcoming government's major conditions plan commits to much closer, quote, alignment and integration between physical and mental health services. And today's debate provides a timely opportunity for the government to tell us more about what this looks like and how the NHS Workforce Plan will actually support that ambition. And we know that, given at any one time, up to 40% of people, for example, with Parkinson's, they will have depression, and up to 30% will experience anxiety, considerably higher than the 17% of the general population who will experience a common mental health problem. And the majority of people, for example, living with the condition, tell Parkinson's that their mental health symptoms are the most distressing aspect of their condition. And recent research commissioned by Parkinson's found that from an audit of unplanned admissions at UCLH, for example, that the length of stay for people with Parkinson's experiencing mental ill health was 29 days compared to 3 days for those not experiencing mental health. And over 2/3 of people affected by neurological conditions, they reported that their mental health well-being needs are not being fully met. And 67% of all respondents, that's children, young people and adults, at a Neuro Alliance survey said their mental well-being needs were being met to a small extent or most often not at all. Moving on to diabetes, it's one of the fastest growing health crises in the UK, with diagnoses of type 2 having almost doubled in 15 years, and there are now over 5 million people living with diabetes, and evidence shows that people with diabetes are twice as likely to experience depression and experience it more frequently and for longer when compared to the general population, Sir Robert. Research also suggests that around half of all people with MS will experience depression at some point in their life, and almost half of people with arthritis say that the pain often or always makes them feel down or depressed. And in fact, a Kidney Research UK 2022 survey showed that over 1,000 people who responded, 67% had experienced symptoms 67% had experienced symptoms of depression, 27% had considered self-harm, etc. And it's not only quality of life that is usually affected, the economic impact of this issue is vast by reducing people's ability to work and increasing health and social care costs. So that puts the situation into context. And I did want to quote from a number of the organisations concerned. As I said at the beginning, I just want people to listen to what they are telling us rather than what I think they're telling us, which is important. 150,000 people, 53,000 people are living with Parkinson's in the UK. And it's often thought predominantly a movement disorder. Between 50 and 60%, however, experience psychosis. 40% have depression. That's according to Parkinson's. They experience anxiety, depression, found communication barriers between departments, difficulty between health departments, difficulties accessing patient notes, and a shortage of mental health professionals with the knowledge and skills to meet their specific needs. Moving on to impact for health, they talk about 15 million people in the UK with one long-term condition or another, and around 3 million live with 3 or more. Poor physical health is inextricably linked with poor mental health, and both can be exacerbated by social context, or in other words, they say, where and how we live. The British Psychological Society said there is growing evidence evidence-based demonstrating the benefits of developing the psychological workforce within physical health care services, provision to support earlier intervention, interdisciplinary programmes of care, and a focus on health, distress and psychological adjustment as part of rehabilitation and recovery. The Cystic Fibrosis Trust indicated that in regards to outpatient care, the paediatric cystic fibrosis service specifications say, quote, there should be access to psychosocial support, unquote, and adult cystic fibrosis services specifications say, quote, there will be access to psychosocial support. And what they're asking is, everyone with cystic fibrosis must have access to a cystic fibrosis social worker and clinical psychologist as and when needed, and not just at their annual review, as NHS specifications say. So the Cystic Fibrosis Trust are indicating that this isn't something that just comes and goes. It's there all the time for many, many people. The Royal College of Psychiatrists talk about having a physical stress can also have a negative effect on how someone thinks and feels. Stress, the sense of self, it impacts upon relationships, understanding the world. And research has shown a link, they say, between mental illness and certain physical illnesses such as cancer, diabetes, asthma, high blood pressure, epilepsy. Moving on to the Marie Curie. They say that while parity of self-esteem between mental and physical health is enshrined in law, it is not yet being realised. There is limited access to mental health support, insufficient training for health and social care professionals, and poor integration of palliative care and mental health care. And the government must centre integrated mental and physical health care within their plans for improving health care. The Versus Arthritis organisation says that depression is 4 times more common amongst those with chronic pain than without pain. I don't think that's surprising, Sir Robert. 20% of people living with osteoarthritis experience symptoms of depression and anxiety. 33% of people living with rheumatoid arthritis have mental health problems such as depression or anxiety. And stress is also a significant factor for people living with arthritis. And I want to quote one of their service users, Richard. He said, I didn't appreciate just how big an impact my arthritis had on my mental health until I became pain-free. The pain took up so much of my headspace without me realising it. Living in constant pain is incredibly draining because it's always there, which makes it more difficult to enjoy everyday moments. The Genetic Alliance, which I know colleagues also have an interest in, talk about rare conditions are individually rare but collectively common, with over 3.5 million people in the UK living with a rare condition. Rare conditions can be both life-limiting and life-threatening. Due to their rarity, services are significantly underdeveloped to support people affected by them. And it goes on to say, almost half of people living with rare conditions and their carers have never been asked about their mental health. And that's according to the Genetic Alliance UK. And families report being denied access to mental health services due to the complexity of their needs associated with having a rare genetic condition. And their solution is necessary to urgently improve awareness of rare conditions amongst healthcare professionals and social care staff. JDRF, the diabetes charity, talks about coping strategies and seeking support from healthcare professionals, including doctors, nurses, diabetes educators, psychologists and social workers, is crucial in developing effective coping mechanisms tailored to individual needs. And the kidney care say addressing mental health and social needs of kidney care patients requires a multi-layered approach, combining clinical, community and policy initiatives. Implementing our recommended strategies will lead to improvements in the overall well-being and quality of life for people living with kidney disease, whilst reducing the burden on the NHS. And I often hear that word burden. I don't think it's a question of it being a burden, to be quite honest. I think it's a question of people's rights to care as and when they need it. I never see it as a burden. We cannot let the repeated absence of appropriate mental health and social support to continue. Now is the time for us to act to ensure that people living with kidney disease get the help they need. And the Kidney Disease UK talk about having a long-term condition dramatically increases a person's risk of mental ill health. Having poor mental health as well as a long-term condition leads to worse outcomes for a person's physical health. And there's a thread running through every single one of these narratives, Sir Robert. Dementia UK, 70,800 people in the UK are estimated to have young onset dementia. And when symptoms develop before the age of 65, yet people affected by young onset dementia remain a hidden population with unmet healthcare needs. And so they talk about the government must mandate every integrated care system to develop a young onset dementia pathway, putting those of working age with dementia at its heart. This includes providing a timely and accurate diagnosis, immediate post-diagnosis support and coordinated care plan, because the impact upon people's mental health and families' mental health also has to be taken into account, Sir Robert. Moving on to scope. At scope, they say, we have been extremely concerned about the recent proposals from the DWP following the Prime Minister's, quote, sick note culture, unquote, speech, which heavily focused on people with mental health conditions. These proposals look to make the benefit system even more hostile, with it becoming more difficult for disabled people, to claim the amount that they need. And basically, it puts more and more stress upon them, and they talk about it being a benefit system which is dehumanising, stressful and complex. That impacts people's mental health, Sir Robert. Crohn's and Colitis UK also talk about people with inflammatory bowel disease are twice as likely to experience mental health problems, and it can affect mental health in different ways. So despite the clear impact, they say, most people with Crohn's or colitis don't have access to psychological support as part of their standard or psychological support as part of the IBD specialist team. Again, this theme running right through. The MS Society talks about mental health and multiple sclerosis. People with MS, multiple sclerosis, are likely to experience mental ill health. A survey of the MS community carried out in the MS Awareness Week in April 2024 found that nearly half of the respondents experienced mental health difficulties as a symptom of their MS. And so they recommend the government develop and implement a neurological conditions talking therapies pathway, and they also want the government to develop and implement a training package for the neurological workforce on mental health awareness. Kidney research talk about there being an estimated 7.2 million people living with kidney disease in the United Kingdom. And they say an adoption of a tailored approach to mental health care through a stepped model that becomes more specialist as needs increase, and increased government funding to research into the relationship between kidney disease and mental health to enable the ongoing development of essential services. And the Royal College of Nursing, who also wrote to me, talked about the parity of esteem. Our members have previously suggested that there's a risk in overemphasising the need for more, quote, counselling and brief talking therapy without parallel and sufficient investment in services that can ensure parity is achieved. And the King's Fund, and I'm coming to the conclusion, the King's Fund talked about a 360-degree review, which talks about prevalence, access, workforce, funding, costs, quality and patient experience, acute mental health care for adults, services for children and young people, inequalities and data. And the LGA have already put in their submissions to the government, I understand, on the major conditions strategy, but in short, talk about taking a whole systems, asset-based approach. So, I think I've done a cook's tour of what all those organisations have said. There's much more. I'm more than happy to send these documents to the Minister for her, or both, one of her staff or staff, to read them, to get a feel for what all those organisations are saying. And finally, thanks to the House of Commons, who basically talk about people with severe mental illness in England die on average 15 to 20 years earlier than the general population. Major causes of death in people with SMI include long-term physical health conditions, including diabetes, hypertension, respiratory and cardiovascular disease. So that thread I talked about, Sir Robert, runs through every single one of those submissions. And in that regard, I hope, and I'm sure the Minister listened to all I said, but more importantly, me repeating and putting out to members what all those organisations said, not what I say, it's what those organisations say, and I hope she'll listen carefully to what they have had to say. Thank you, Sir Robert.
The question is, this House has considered mental health and long-term conditions. Liz Twist.
Thank you very much, Sir Robert, and it's a pleasure to serve under you as Chair for this debate. And I'd like to thank my honourable friend, the Member for Bootle, for securing what is an incredibly important debate. Now, dealing with a long-term health condition can create a significant mental health burden, both for the individuals themselves who have these conditions, but also for those that love and care for them. This is something that I see regularly as a constituency MP, but also in my work as chair of the APPG on rare genetic and undiagnosed conditions. According to the Royal College of Psychiatrists, people with physical health problems are 2 to 3 times more likely to have depression than people who have good physical health. Conversely, people with severe mental illness in England are almost 5 times more likely to experience poor health and die prematurely, as we have heard from the Honourable Member from Bootle, than those who do not have severe mental illnesses. And this, Mr. Robert, is a gap, a mortality gap that's widening. So we're facing a really difficult cycle here, but there are things that we could be doing to make things easier for people. Now, that applies to people with a whole range of conditions, as we have heard, all of whom have specific needs. And just to name a few examples, I think of people with diabetes and their experiences of diabetes distress, which can look like major depressive disorder, but is often closely linked to glycemic management and self-care. I think also of people with Parkinson's, again, whom we have heard about, nearly half of whom have experienced anxiety and depression, which is often triggered by the stress of receiving a diagnosis. as well as the physical changes in the brain caused by the condition itself. Today, however, I'll focus particularly on the difficulties endured by those with rare conditions, which can be very acute. Whilst these conditions are individually rare, they are collectively common, affecting over 3.5 million people in the UK. That's 1 in 17 people. And we've heard of one such organisation, cystic fibrosis, referred to again by the Honourable Member for Bootle. But talking about rare diseases across the board, a significant proportion of people with these conditions are particularly devastated in their impact, with more than 3 out of 10 children with a rare condition dying before their 5th birthday. We should be doing everything we can to make their lives easier, but instead research from Genetic Alliance UK reported many families describing their experiences of accessing care and support as a battle or a struggle or a fight. These experiences reflect a number of challenges, including a lack of clinician awareness, long delays in diagnosis, a widespread lack of licensed medicinal products to treat conditions, and difficulties accessing services such as education, employment, housing, social care, and financial support. For those without a diagnosis, these challenges are particularly profound. No diagnosis means isolation from community support, difficulties filling in paperwork to access services, and often no prognosis, meaning individuals and their families have little to no idea with how their condition will progress and even whether or not the condition will be life-limiting. The situation these families live with is complex, unique, and often extreme in terms of the stress being endured. As one parent puts it, you end up fighting battles you didn't even know existed. Now, dealing with all of these challenges, let alone with the condition itself, can lead to stress, exhaustion, and even suicidal thoughts. Further research from Genetic Alliance found that 70% of adults affected by rare conditions and their caregivers have described themselves as at breaking point, with more than 90% reporting anxiety, stress, and low mood. Now, despite this, 75% of respondents to the Rare Minds 2023 survey say they have never had a healthcare professional offer support or even signpost them to support for their mental health. So, Robert, it's undeniable that as things stand, we are letting families down. We must take steps to urgently improve awareness of rare conditions among healthcare professionals and social care services. This includes providing the training and resources that professionals need to support patients through their entire care journey, right from symptom presentation to diagnosis, to treatment and management of the condition. And we need those professionals to be familiar with the challenges of living with a rare disease and handle discussions about mental health sensitively. Assessment of mental health needs and access to mental health services should be something that patients are able to access on a routine and regular basis. Now, the UK Rare Diseases Framework has looked at the issue of mental health in the England 2023 Action Plan, as it was highlighted in feedback on the 2022 Action Plan. And actions from the 23 England Rare Diseases Action Plan target addressing the mental health issues which this community faces. So all new and revised service specifications for patients with rare diseases should be required to consider users' psychosocial needs and ensure coordinated pathways for access to mental health support. Commissioning research to provide the evidence needed to operationalise better coordination of care, specifying that this should include approaches that address integrating mental health support into rare disease clinical care. And I should say, Sir Robert, that when I talk to families with rare diseases and people with rare diseases themselves, one of the things they talk about is that strain of pulling everything together and having to make sure that they have coordinated care, which in itself puts a stress on them. And there were provisions to look for the NHS Workforce Education and Training Directorate to look at developing further educational contact. But still, there are things that can be done. And what we would ask from the rare disease community is that the Department for Health and Social Care, which hosted a workshop in 2023 to better understand the challenges faced by the families of children and young people with rare conditions when accessing mental health services. So now we understand the needs of the community. We need to see those priorities materialised into tangible change. And the current UK rare disease framework runs out in January 2025. So it's time to be planning ahead and must look ahead to take steps to build on the progress that has been made so far. So, you know, while I'm currently making the case for rare diseases and rare conditions, this coordination, this planning is something that we need to see right across the board, a recognition of the impact of mental health on people with long-term conditions. There's no one-size-fits-all solution for people with long-term conditions. And the most important thing is having access to a clinician that understands their needs. Help shouldn't have to wait for a person to be diagnosed with a mental health problem. It's easier to protect and maintain mental well-being than to restore it after it's been eroded. But with our mental health system so very stretched, it's been difficult for patients to access even the most basic support. And looking more widely, to talk only of CAMS for young people, there are currently more active referrals than there have ever been, with nearly 500,000 young people currently in the system. And despite this record level of demand, it remains the case that around 2/3 of children considered to have a diagnosable mental health condition don't have any contact with the NHS. So we need a firm commitment and a detailed action plan and workforce plans from the government to deliver the mental health, tackling the mental health crisis, with opportunity too for proper parliamentary accountability to assess progress. It's particularly vital that we provide better support within the community to support all of those with long-term conditions. And I'm pleased that the Labour Party have set out our plans to achieve this. I hope that the government can deliver on this and take firm action to support those with long-term conditions with their mental health. Getting our mental health services back on their feet will play a vital role in tackling the vicious cycle between poor mental health on one hand and poor physical health on the other. With proper parity of esteem and a holistic, person-centred approach to care across our health system, I believe that we can make the most challenging aspects of people's lives easier for them as they live with long-term conditions. Thank you.
Thank you, Sir Robert. Privileged to be under your guidance as the chair of this meeting. I'd like to thank my honourable friend from Bootle for taking this very, very important issue in debate here today. I declare an interest, Sir Robert, because I have suffered from kidney failure and I was very fortunate to be able to get a transplant. Most patients aren't that lucky. I was very lucky because a very good friend of mine gave me his kidney as a live donor. Those are extremely rare as well. And people need to understand that in terms of the donor card issues that we have in terms of trying to pass on organ donations, the problem with that system at the moment is it depends on the next of kin. If the next of kin don't abide by the decision taken by the deceased, then none of those organs can be taken or transplanted. So therefore, there's still a real issue for us to address in terms of looking at these issues. And the reason why transplants are very important is it changes your life. It changes your life from somebody who, myself, have been through dialysis for almost 4.5 years, and then was fortunate enough to be taken that transplant. The transplant, I must say, was given by a very good friend who was in this place before he left and went to the European Parliament, and now is living in North Wales, having a fantastic time doing some consultancy as well. It was Sean Simon, who still is a very good friend and a great person, and I just pay tribute to his courage. And I think more people should take that, because a lot of us, unless we have other issues, we can survive on one kidney, and he certainly is a very great example of doing that. But people in that position, first of all, when you end up with kidney failure, it's very sudden. You don't realize that it's upon you until it's upon you. But that can be avoided. That can be avoided by some simple tests. When people go to their GPs or go to hospital for tests, a simple urine test can give people the analysis of your kidney function, and they can do something about that, and therefore hopefully take actions, preventative action, to be able to make sure that you don't proceed to loss of a kidney. Also blood tests, a number of people have blood tests. So when you go for a blood test to do that, those are very easy, preventable ways of doing this. Because that saves you, obviously, in terms of your physical health, but more importantly, what we're talking about here, Sir Robert, is the issue of mental health. Because once you're a kidney patient, you have to seek dialysis of some sort. There's peritoneal dialysis, and there's hemodialysis. I took hemodialysis, which is through a machine which circulates your blood. Peritoneal dialysis you can do at night, which circulates the impurities out of your system through using a fluid bag and obviously an exit bag as well. So those are the systems. But one of the main problems is when people get this sort of a very difficult health condition is that they think, why me? What have I done to deserve this? And I had, unfortunately, experiences of people in the dialysis unit who find it very difficult to be able to see, to come to terms, come to mental health terms, just to justify why it was them. When you go on dialysis, you spend at least 3 times 4-hour sessions on dialysis. It reduces your blood pressure significantly. And when you're on dialysis, one of the last things you should do is have fluid in your system, i.e. you could drink as less water as you possibly can, because that's going to be extracted through the process. So when your blood pressure drops, it causes a huge issue, physical issue at the time. Of course, heart rate increases and other issues from that. You could pass out as well, which I did a couple of times. But I was very grateful for the people in the unit who acted very swiftly to support me in that. So a great tribute to all those renal medical staff, doctors, consultants, and particularly the nurses at regional units who do a fantastic job to support all of us. So during that period, I've seen a number of people who've gone through real mental health struggles. Real, because coming to terms with something like this, having to turn up to a unit every week, you know you're going to be there for 4 hours, it'll take ultimately about at least 6 hours of your day. Because by the time you get there, the time you get ready, and then you come off, and if somebody's picking you up or you have to transport, it just takes a huge amount of time to do that, Sir Robert. And therefore, you're stuck in that cycle. One of the things that people can do, which I resorted to in the end, is home dialysis, where I was able to dialyze myself with support at home. So that made it slightly easier. But it is a hugely debilitating condition to be in, because, as I've said, a number of people really had real difficult mental health problems in order to come to terms of this debilitating disease that they were under. There's lots of questions. Unfortunately, a friend, son was there with me, a lot younger than me. Unfortunately, he passed. I've seen other people who've passed because of this. And part of that is to do with staying strong mentally. And when there's no support for that, it becomes increasingly difficult. And that's why it's very important to have this issue that my right honourable friend from Bootle has raised of mental health, on diabetes and all of these long-term issues, is that ultimately your mental health is put at risk. And quite severely, as it gets longer, it becomes under a huge amount of risk. And that is, I think, why I want to thank my honourable friend from Bootle for having brought this debate and giving me the opportunity to say this, to be able to say this. In 2022, Kidney Research UK carried out some results which found 67% have experienced symptoms. These are kidney patients. 67% of patients have experienced symptoms of depression. 27% have considered self-harm or suicide. 36% reported not being able to fully look after their physical health due to their mental health problems. And 68% not offered any mental health. 68% of those people in that very precarious position have not been offered any mental health support. That's how difficult it is for those people to be able to try and make their way through. So this is very important, the issue of mental health issues that need to be addressed. In 2023, Sir Robert, Kidney Research UK and the Centre for Mental Health published a joint report addressing the mental health challenges of life with kidney disease, the case for a change. And they have made a number of recommendations, sir. They made a recommendation including adaptation of a tailored approach to mental health that becomes more specialized as the need increases. The need increases because your physical health deteriorates. And so therefore it's extremely difficult trying to do some of those things that are normal for all of us. And so it becomes very, very difficult to do that. It also recommended that recruitment of renal psychologists for every renal centre in the UK. We don't have that facility. And so even if somebody picks up in a renal unit that you are having these issues, they've got nowhere really to go. So all they can signpost you to the main central mental health facilities. That is very difficult then to engage with. And as it increases, it gets worse. So your own position, health position, gets worse. That's why it's very important to have those psychologists in every renal health centre in the UK, unit in the UK. Investment into all renal services to ensure that the staff are trained and supported to assess and refer patients for further mental health help. So once they can do that, then they can put them on a pathway to be able to resolve most of these issues. And it also recommended increased government funding for research into relation between kidney disease and mental health to enable ongoing development of ensuring this service is properly dealt with and supported. So you have a condition which is a medical condition, but on top of that, you're aligned also with the mental health issues that are born through the severity of that condition that you're in. So that causes a huge amount of problems, Sir Robert. And that's why I thank, again, the Honourable Member for Bootle for making this case. It's allowed me the opportunity to do this. And I want to thank very much you, sir, for giving me the time to say this. But it's really important for those that are left at the moment who can't have a transplant, who are still suffering from kidney disease and having to make dialysis a choice which they have to deal with for most of their life. And it's very difficult for them. Thank you, sir.
We now move to front bench spokesman, Abina Opong Asari.
Thank you, Sir Robert. It's a pleasure to serve you in the chair. I want to start my remarks by thanking my honourable friend for Bootle for securing this important debate. I know this is a topic very close to his heart, particularly as he is the officer for the Health APBG, and I know that he recently did a keynote speech talking about mental health and well-being for the NHS and social care for Westminster Insight. Today, he has highlighted a number of important issues and concerns regarding mental health and long-term conditions, and I'm pleased to be able to respond on behalf of the opposition. I also want to take the opportunity to say that a lot of the stuff that my honourable friend raised was in the words of a lot of organisations who have done a lot of work and research into the areas that long-term conditions impact individuals. And particularly, I was touched particularly in terms of the fact that it was also about the things that he talked about in terms of the fact that the impact it's had in terms of limited access to mental health support, poor palliative health care. And as he said, he did a cook's tour of what all the organisations have said, and I hope the Minister does take on board what he has raised in the words of those organisations. I'd also like to take the opportunity to thank my honourable friends for Blaydon and Birmingham Perry-Barr for their contributions. The Honourable Member for Blaydon, who is also the chair of the Rare Genetic or Undiagnosed Conditions, talked about how different conditions have impacted people in terms of if we looked at how things such as diabetes and Parkinson's were made better, it would mean that their mental health would improve. She focused on the difficulties with those with rare conditions and highlighted the powerful statistics of where 3.5 million people, and which is 1 in 17 people, are impacted. And she talked about a parent who said you end up fighting battles you don't really know existed. I also like to thank my honourable friend for Birmingham Perry for sharing his personal experience. He talked about the issue related to transplants, along with how it's changed his life, and talked about how it impacts the mental health of patients when they encounter dialysis. He talked about how 67% of kidney patients experience depression, and 68% are not offered any mental health. So it is fitting that today we are addressing this crucial topic, particularly because this marks Mental Health Awareness Week. And I also want to start by paying tribute to all those fantastic mental health charities who are fighting the fight and leading the way across the UK. Those include the Mental Health Foundation, Mind, Centre for Mental Health, Rethink Mental Illness, Samaritans, Young Minds, and many more. Alongside these brilliant charities this week, we have also observed schools, universities, businesses, community groups, and many other organisations, including here in Parliament, coming together to raise the awareness about the importance of our mental health and how to combat the lingering stigma that remains part of our society. I also like to add on record my thanks to the House of Commons Library for their research in this area. Thankfully, it's true to say that in recent years, talking about mental health has finally stepped out from the shadows, and we are better off as a result. But while we celebrate the progress that has been made, we cannot overlook the scale of the challenges we face. And I have to say that sadly, after 14 years in office, this government has failed to deliver the required mental health services our country desperately needs and deserves. And it has never been as bad as it has been today, and I hear this time and time from patients, from families, from NHS frontline staff who I've been fortunate to meet since my appointment in this role. And the statistics on this crisis are clear. More than 1.9 million people are waiting for mental health treatment. Almost 1 million children and young people in England are referred to mental health services last year. And there are over 33,000 children and young people still waiting after 2 years for a first contact for community mental health services. And as a recent report published from the Centre for Mental Health estimated, that this crisis is costing us $300 billion a year, a cost that is twice as big as the NHS England's annual budget. Suicide is the biggest killer of lives in this country. It is the biggest killer, with rates that were the same as they were 20 years ago, and they are rising. And when it comes to those with long-term physical and mental health conditions, we must be particularly concerned. Far too many people are leaving the labour market, and many are not longer able to work. Work is good for mental health, and can bring pride, fulfilment and purpose. Yet there is a number of people out of work because of long-term sickness at an all-time high, which is currently staggering at 2.8 million. The reality is that this has all occurred under successive Tory governments. Britain has become unwell, with millions languishing on waiting lists, and far too many lives are living in conditions of poverty, poor housing and financial insecurity that worsens mental health. We cannot stand by as this crisis continues. That is why we need to address the challenges together. And as my honourable friend has mentioned, working across departments in Whitehall and also directly at the heart of our communities. And this is something that a Labour government would do, where we will inject resources and reform the NHS mental health services. We can't just turn around at the shocking figures that have been produced by my colleagues in this debate, but we have to look at how we completely overhaul the way our country approaches mental health. For example, we need a prevention-based approach where people can access mental health support in a community when they first need it, rather than wait until they reach a crisis point. Prevention is not only socially just, but also economically efficient, as my honourable friend for Bootle mentioned. It saves lives and it saves money. Therefore, Labour will give the NHS staff it needs by recruiting 8,500 more mental health specialists to cut waiting lists and waiting times. We'll also provide mental health support in every school and an open access mental health hub for children and young people in every community. And these plans will be fully funded but fully paid by abolishing tax loopholes for private equity managers and ending tax breaks for private schools. But we cannot discuss the topic of mental health without talking about the long-awaited reform of the Mental Health Act. Labour is committed to reform the Mental Health Act in our first Kin speech, reforms that the Tories promised in 2017 and 2019 manifestos, but have failed time and time again to deliver. The treatment of people with autism and learning disabilities under this outdated legislation disgraces our society, and the way in which black people are disproportionately impacted is indefensible. This law is not fit for purpose and needs to change. And if elected, Labour will change. Therefore, I want to thank my honourable friends for bringing forward this debate, and particularly for the honourable member for Bootle for bringing this debate. But I also want to make clear that it's inspiring to witness and the widespread and positive contribution of mental health awareness this week. There is a clear yearning from public and especially our young people to end the stigma and treat mental health with the same urgency as physical health. So we must transform this pressure into action. Thank you, Sir Robert.
Thank you. Minister Maria Caulfield.
Thank you, Sir Robert. It's a pleasure to serve under your chairmanship, and I'm grateful to the honourable member for Bootle for securing this debate about mental health for those with long-term conditions, especially during Mental Health Awareness Week. And I'd just like to thank everyone who contributed to the debate, the Honourable Member for Blaydon, who does such great work with her all-party parliamentary group around mental health and suicide in particular. But I think the standout speech, if other Honourable Members don't mind, was obviously from the Honourable Member for Birmingham Perrybar, with his experience of going through a long-term condition himself, with having to have dialysis for renal disease. And just highlighting, obviously, the physical impact of that, but the effect on his mental health and how that plays out with the uncertainty of what organ donation and an organ transplant can bring. Just to touch on, I know this is a debate, Sir Robert, on mental health and long-term conditions, but just to touch on the issue he raised about opt-out for organ donations in England. We did bring that in May 2020. I recognise that there are some issues with families still, even when someone has consented themselves, refuse organ donation. We did commit in February last year to implement the recommendations of the organ utilisation group. Some of those findings found that, yes, the opt-out system had some issues, but also there was also issues about the use of organs that are donated and making sure that they do go forward for organ donation. So I absolutely recognise some of the comments he made. But I want to reassure everyone in the chamber this afternoon about our commitment to improving mental health and well-being, and in particular around those for long-term conditions. I think it's fair to say that over the last 14 years, we have seen a shift in removing the stigma of mental health overall. People are much more willing to talk about their mental health, discuss issues they face, and some of that stigma about having either mental health problems or a mental illness itself, we are breaking down those barriers. We've also made progress on parity of esteem between physical and mental health, and I'll touch on some of the funding we've made available to mental health over the last few years, which has really been the most significant funding ever in England. That's not to say it has met all the challenges we face, but absolutely in terms of funding, in terms of infrastructure, in terms of staff recruitment, we are driving forward to get mental health and physical health on the same level. Our challenge now is to make sure, and when I spoke at the Mental Health Foundation event in Parliament yesterday, I made this point, is to make sure that we don't just silo people into having a mental health problem or a physical health problem. And I think the Honourable Member for Birmingham Perrybar just brought that together so well, in that we can't just treat people in isolation. We know that people who suffer with mental illness have significantly poorer health outcomes from some of our major conditions such as cancer and heart disease. And likewise, people with long-term conditions struggle with their mental health. And that's why we are, in our major conditions strategy, we've put mental health in there. And we did get some criticism when we announced that we wouldn't be doing a standalone mental health strategy, but it was for that very reason, that you cannot treat people in isolation. We need to treat both their physical and mental health together. And that's why in the major conditions strategy, mental health is one of those major conditions that we will be focusing. And it's also why, through the NHS long-term plan, we've increased record levels of funding to increase our mental health workforce across England. And our target was 27,000 mental health workers, and we're on track to meet that target. And our NHS forecasts show that since 2019, our spending on mental health services has increased by £4.7 billion in cash terms, compared to our original target of £3.4 billion. And almost 16 billion of that was invested in mental health, enabling 3.6 million people to access mental health services. So there is significant investment and resources going in. But I recognise that the demand is a tsunami effect, that we are struggling to just even tread water. We've had a 46% increase in the number of referrals, and that is also the case across the United Kingdom and not just in England. And I think it's fair to say that in Wales, they've had similar experiences, with child mental health weights up 14% in July of last year compared to December 22 the previous year. Overall, I think in Wales there's been 30,000 people on the waiting list who've waited more than 2 years overall. So the challenges we face in England are exactly the same as in Wales. And actually, I think it's more appropriate to take the politics out of it and actually deal with the crux of the matter causing some of these. Now, what I'm really pleased about is the types of services we're investing in mental health services is not just for people with a mental illness. And I think it's really important that we have bespoke services for people with specific mental illnesses, but also we improve the mental health of the country overall. And one of our biggest successes has been the flagship NHS Talking Therapies programme, which is for adults everywhere across the country, and it's accessible on our NHS website. We've got the Every Mind Matters website that you can access there. People can self-refer, people with diabetes, with Parkinson's, with cancer, with MS, with renal conditions. Anyone can access those services, and so far over 1.2 million people have accessed these during the last year, an 11% increase since the start of the long-term plan in 2019. And we want to we're expanding this further, particularly to help people with mental health and long-term conditions, and working with colleagues in DWP to work with those people who may be struggling to find work because of a long-term condition and the mental health effects that has had. And so we do recognise that 2/3 of people with common mental health problems also have a long-term physical health problem. And one of the key issues we do need to overcome, which wasn't mentioned in this debate, is if you have a mental illness, you may also have cancer, diabetes, renal problems, but sometimes that diagnostic overshadowing, that assuming it's someone's mental health problems, that they're complaining about pain, or they're describing other symptoms, they're not taken as seriously as someone who doesn't have a mental illness. And that diagnostic overshadowing is sometimes responsible for the poorer clinical outcomes. So there's a piece of work across the board. It's not just about providing services, it's about changing that culture so that people with a mental illness, with long-term conditions, are also getting the help that they need. Now, just on the talking therapies point, all integrated care boards now are expected to expand their services locally by commissioning NHS talking therapies into physical healthcare pathways. And I know the Honourable Gentleman talked specifically about some of the work on renal disease. Now, NHS England has published a series of service specifications covering renal services, and it's been developed by specialist clinicians and commissioners and patients by experience to setting out the standards of care expected for specialised renal care, which does include clinical psychologists. Now, I recognise that that's not happening everywhere. There's regular review meetings between regional commissioners, and that's something I'm very happy to follow up with him about, to update him on perhaps where there are some gaps in service provision there. But there is a service specification that should include those services for renal conditions as well. Now, I'll just move on, if I may, just to talk about the fact that for suicide prevention, we released our strategy fairly recently, and we have put in there that people with a physical illness are more at risk of suicide or a longer-term condition. It is a risk in suicide rates. That's why physical illness is now included as a key national risk factor for our action in our 5-year suicide prevention strategy. And I'm very happy to update members about the progress we're doing. There's 130 actions that we will believe will address some of those common risk factors and make swift progress. In terms of the support we're giving to people with long-term conditions and the ability to live better with a long-term condition, we are also providing the support across the board as well. And it's really important that teams who are looking after people, whether it's with cancer or diabetes, are aware of the emotional and psychological support needed. And very often, it has historically been the case, you refer them to the mental health team. That's not always what's needed. Some basic support can do a huge amount to improve the psychological well-being of patients. Now, I just quickly want to touch on children, because that was raised in the debate. And I just want to update the House, because children have long-term conditions too. But we are putting significant support. Only a few weeks ago, we put funding forward for 24 early support hubs. And these are support hubs for children with, who want to get mental health support. There's no referral required. They're done on a local basis, and the services are provided to the needs of the local community. And £8 million has gone towards the funding of those 24 projects, and we are evaluating them to see, are they actually making the difference we need them to make. We're also rolling out our mental health support teams in schools. Over 4 million children now, via 400 mental health support teams, are providing support to just under 50% of our schools. And I think that is making a significant difference. So if a child has a long-term condition in school, they will have teams within their school itself being able to provide emotional and psychological support to them as appropriate. So I hope, Sir Robert, I've done a bit of a whistle-stop tour, perhaps not a cook's tour, as the Honourable Gentleman did, but absolutely share some of the concerns that honourable members have raised in the chamber, chamber, but I hope I've highlighted that there's some exciting, groundbreaking work happening in this space. And in Mental Health Awareness Week, I think it's really important that we do talk about mental health problems for people with a long-term condition and recognise the impact that being unwell for over a long period of time, whatever the cause, affects a person and their family. And that's why it's so important that we have whole person treatments, whole person support to improve both the physical and well-being of individuals. Thank you.
Brief final remarks, Peter Dowd.
Thank you, Sir Robert. First of all, can I thank you for your excellent stewardship for today's event. And I'd like to thank the member for Blaydon and frank salute her commitment to the rare diseases field, which I know she worked very hard on, and also thank my honourable friend, the member for Birmingham Perrybar, for his compelling articulation of his personal experiences. And I think we'd all like to thank him for that. And I thought I'd like to thank my honourable friend, the member for Erith and Tameside, for her response. Thank you very much. And of course, to the Minister for listening and responding. And finally, a big thanks to all the organisations who I referred to earlier on. Thank you, Sir Robert.
Is that this House has considered mental health and long-term conditions. Is many of that opinion say aye? Aye. To the contrary, no. The ayes have it, the ayes have it. Order, order. The sitting now stands adjourned. Thank you.
The proceeding has ended. 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 The proceeding has ended.